touched upon vaping, and it's all over the news right now, vaping and the deaths across the country. In Ohio, they haven't pulled the oil cartridges off the shelves. People are still allowed to purchase those. Kind of, just from your perspective, whether it's your personal or company-wide perspective, you're going to have patients coming in and you're offering this product. How do you see things right now with the vaping?
This is probably the trickiest question because there isn't enough data out there right now to come to a conclusive, there's no way to identify what's exactly causing these issues yet. There just hasn't been enough data, not enough studies done to really analyze the deaths related to these lung issues and the compound that's causing them. What my personal opinion is, it seems like the majority of these cases is coming from products bought in the unregulated market, whether they're e-cigarettes, THC-based products coming from other states where they don't have strict mandates to do product testing. Whatever it is, there's cutting agents, there's trace elements and metals that can get into it, there's flavoring agents, they're talking about vitamin E acetate. All these compounds are hypothesis to maybe cause these conditions. What I do know though is every product sold in an Ohio medical marijuana dispensary is going through mandated state laboratory testing.
Big point.
While I don't want to say that solves the problem, I don't want to give people a false sense of security. I also don't want to give people a false sense of fear in the sense that we don't know what's causing this. There's a high likelihood, in my opinion, that it's from the unregulated market. At least when you buy these vape products from a regulated dispensary that is going through state mandatory lab testing, that some of these compounds that they're suggesting could be causing these issues, we know aren't in them because the labs are required to tell us what's in their product. So I think, listen, vaping helps a lot of patients. When you have, like we were mentioning before, pain that comes on suddenly, a panic attack, whatever it is, vaping is the quickest onset of action you can have. You can find relief within minutes. So to just say, okay, this could be dangerous coming from the regulated market, let's just remove this product off the shelf. Well, now you're forcing patients that need that relief real quickly to something that takes a little bit longer to work. And way that might not be a big deal to some people, if you're dealing with something really severe, whether you find relief in a couple minutes versus 10 to 15 minutes, it's very important to them. So that's one side of things on why I believe I don't think we should remove these products off the shelf if they're being tested through state laboratories that are overseen by by Ohio. And especially because we don't really know what's causing it. And it's probably not something that is coming from the regulated product.
Definitely.
While it could be, I don't want to, while I said don't give people a false sense of security, the false sense of fear is also a factor here. And if someone is finding relief from these products or the convenience factor of it, now you're taking it off the shelves. You're just pushing people from the regulated market to an unregulated one. So if they're finding relief from these products, it's not like they're going to stop using them just because they're not available at the dispensary. They were using them previously. You would think they would probably try to find a way to find it still. And now what you've done is push people from the regulated market to an unregulated one, and where there's a higher likelihood of where these lung problems are originating from, compounds from the unregulated market, and the very problem you're trying to solve by banning it, you're actually making it worse by pushing people to this other market.
Very great take. That's a very great take. Very informative. I think that's our time. We got Dr. Ronnie Cineroy.
Pleasure talking with you.
Pleasure talking with you too. You can see Dr. Ronnie at The Botanist. Here's Columbus's fourth and most recent dispensary. Dr. Joel Simmons, Ohio Herbal Clinic, and until next time.